Hello, my name is Amber LaRocque and I'm a staff writer with Emergency Vets USA as well as a licensed veterinary technician. Our goal at Emergency Vets USA is to educate you on topics regarding your pet's health. So today we'll be discussing ear hematomas in dogs. A hematoma is just a pocket of blood that is trapped within some type of tissue. So an ear hematoma is just that, a hematoma that is trapped within the pinna, which is the dog's ear. Dogs can develop ear hematomas due to multiple different reasons, but the most common cause of an ear hematoma in dogs is trauma to the vessels within the ear. And the most common trauma, which is pretty shocking to most owners, is just violent shaking of the head. We do sometimes see dogs with secondary ear hematomas after they get bitten on the ear or scratched on the ear. But the most common cause of ear hematomas in dogs is violent head shaking due to a serious ear infection. Our dogs just can't make sense of the pain that comes along with an ear infection, and there's really no ways for them to seek comfort. So what they will do in an effort to relieve their pain is shake their head. They may even paw at their ear, and all of this together can lead to trauma of the vessels in their pinna. So some of the most common signs of an ear hematoma in dogs is noticeable swelling of the pinna itself. Sometimes this can be minor swelling and sometimes it can be huge, so huge that it catches a lot of owners off guard. Your dog may also be shaking their head even more, leading to an increase in the size of their ear hematoma. They may also be leaning to one side, often of course the side with the ear hematoma. They may paw at the ear as well, and they just may appear restless and uncomfortable, and this is because the ear hematoma is often very painful. Not only is their ear hematoma painful, but a lot of times the infection that led to the ear hematoma is also very uncomfortable. While it is considered rare, some minor ear hematomas will go away on their own, and basically what happens is the body will just absorb the blood that is in the ear. But this still takes time. Sometimes it can take a couple weeks for the body to absorb the blood, and in that time the ear hematoma will still be very painful, and it will also lead to thickening of the tissue in the ear, and oftentimes we describe it as cauliflower ear, like what you see in professional fighters. So that same process can happen to your dog's ear, and that often occurs when an ear hematoma is not addressed by a veterinarian. So there are two standard treatment options that your veterinarian may explore if your dog has an ear hematoma. The first one involves surgical repair of the ear hematoma. What your veterinarian will do is place your dog under anesthesia. They will make a small incision on the ear to allow the ear to drain of the blood, and they may also be able to remove any clots that are present as well. At this point, what they will do, and every veterinarian has a slightly different approach when it comes to this, but the most common option is placing multiple stitches within the ear, because what this will do is eliminate any dead space that more blood will continue to pool. And this will also in turn lead to less scar tissue throughout the healing process. Once the procedure is done, your veterinarian will often wrap their ear in a bandage, so they will have a head wrap, and then they will also send you home with an e-collar that you will need to keep on at all times until their ear hematoma is completely healed. The next treatment option involves draining the ear. What your veterinarian will do is drain the ear with a syringe. They will basically just aspirate the blood from the ear hematoma, and then what they will often do is inject a steroid into the ear, and what this will help to do is relieve the inflammation that is present. But it's important to note that through this method, most dogs will have to continue to return to the vet 1 week later, 2 weeks later, sometimes even 3 weeks later as well, because their ear will continue to fill with blood, and basically the process will have to be repeated. So the best approach is typically the surgical repair, where the ear is lanced and the stitches are placed. But sometimes cost concerns are at play, so if you do need to do needle aspiration of the ear hematoma, that is a treatment option available. You just have to be aware that it may take a bit longer. For an in-depth review on ear hematomas in dogs, be sure to review the article that is attached to this video, but stay tuned to Emergency Vets USA for more topics on pet health.